Good evening again. Dr. Philip Ofori-Yentumi holds a doctorate degree in nursing practice from Northern Kentucky University. He started his nursing career as a nurse's aide before pursuing an associate degree in nursing from Gallon College of Nursing in Cincinnati, Ohio in 2013. He went on to complete a bachelor's of nursing degree from Miami University in Oxford, Ohio. He later on pursued his master's degree as a psychiatric mental health nurse practitioner from Walden University. Philip once served as a director of nursing at an inpatient psychiatric hospital in Dayton, Ohio. Philip is affiliated with the American Psychiatric Nurses Association. He is the founder of Feel Good Services. He realized the gap between the perception about mental health and the reality. He then decided to educate the minority community, especially the Ghanaian community, on mental health. He has a YouTube channel, Feel Good Services, where he streams video to educate the public and reduce the stigma surrounding mental illness. Through his work, Dr. Ofori-Yentumi is using his passion to change the mental health care narrative, both in diaspora and in the continent of Africa. Now we'll move on to our theme song.
My heart can sing when I pause to remember. A heartache here is not a stepping stone along a trail that's winding always upward. This troubled world is not my final home. But until then, my heart will go on singing. Until then, with joy I'll carry on. Until the day my eyes behold the city. Until the day I'll go straight home. Until then, my heart will go sing. My heart will go sing. Until then, with joy I'll carry on. Until the day my eyes behold the city. Until the day of calls me home. The things of earth who didn't use their value in their recall. The borrowers for and things of earth that cause the heart to drown. Remember that will only bring us down. But until then, sing God thinking. Until then, the child until the day my heart will go singing. Until then, with joy I'll carry on. Until the day my eyes behold the city. Until the day God calls me home.
My yende nyame ase esan so ye na nado e woda. We want to thank God for such a day. Yes, until the day glorious things the Lord has done for us, and also Nadaroma obetimi. It is with much excitement that I get to present today. Now, there's been other speakers, and now me catch one of the organizers, and they say, oh, your program, this and then they say a series. Not the only speaker. Yeah, not sometimes, you know, who baby are the papa because I can say you know with DNA. Oh, there's been other speakers, and they've set the bar so high. The various speakers, no, my buddy, you know, they've set the bar so high. It's me following right now, no. It's like, what are the participants expected? So I only pray, say, I won't disappoint you. But so just sit back, relax, and enjoy this evening's presentation. Okay. The other thing is, you better organizers know us. Say, or more a program, now, right now, our options are unlimited because yeah, you will Zoom. You know, anybody at all can come and speak on it. Now, so now what to do with all the resources available to you, you chose to say member kasem. Enti no madam wase say more yen so no my friend na so member boa na dwumedie enti me nkoso. Madam wase pay, I don't take it lightly or for granted. Thank you very much. And also tonight's presentation, as we've always done it, you know, message is going to be very interactive. I know how Zoom works. But they're not close to the device or board the ATN. But for tonight, you know, message we're not going to open for us to interact with voice. And yes, I heard Jesus. But what I want us to do is say, yeah, sending messages, right? Let's use the chat room a lot. I'll try and read as I go along. It also helps me to gauge your work during the presentation as to whether you are following the level of understanding and all of that. That is all I ask of you. Not the no mon kind with boom abra may present analysis media and I chose my words carefully. Media, which means to say you also have a role to play. It's no me pacho member like chance or renko. Men tradia, at least not for now. You know, you have a dinkobo, not media yet me esiade. Abra says Emma introduction, you realize the running a phrase mental health, and as I said, oh, he worked in this, he worked in that, he worked in that, which gives the impression said mental health has been made the minimum, right? For my professional career, has always been around psych. So I have this bias towards psych, and I would want to say instead, there is no health without mental health. There is no health without mental health. Say adwuma pomodi eni honoma apomodi bi eni honoma ehu hia. And also say ewo honom, because if you're not able to function well mentally, if you have diabetes, if you have cholesterol, if you gain weight, if you're doing anything at all, you will not be able to comprehend and be able to manage that. So it is very important. And when you say you to be taking care of our mental health and assess the state of our mental health, it's very, very important. Now, me try say me de brofo kakra na mete no ebefra. Say be ya mebunu na wo so no ebetime follow through. Dr. Ewu Esiem did much better than probably I would do. Now, this was piece. I did your share of the brofo hame. It is that the share says you make a so you also realize, you say, in my presentation and in my style, as personality, I like to use sense of humor, right? Because the environment in which I work, is full of stress, right? It's full of stress. It's so demanding. And Indra, Dr. Ewunieka, stress oneself, so heavy. So if you don't lighten it up a little bit, and you use the same posture and the year presentations I do so much. You say after the assembly, you might lose it. Okay, and if you see me throwing in some humor in there, it is not to lighten the situation itself, but it is also to make it a level playing ground to where we are all comfortable to share. Okay, and possible, and then the demand and the mental health, dependency, and addiction. And this whole week, the the biblical perspective, 1 week to wellness. Well chosen, 1 week to wellness, the biblical perspective. And this is where I want you to give me the feedback. Yes, I see if he has it. Say, dependency, any addiction. Question number 1. Do you think it relates to us in the church? So, what you say, Yeni ayewo asafuimu, akwarshafo asafuimu, SDA, Central Zone. So, what you say, efayeho. So, what you say, ebiwomusa. So, what you say, eyadia ediyenya. Only one answer never so far. Hey, itimpacho, me pese, okay. And if so, Mama my second question. See, I can say dependency and addiction. A day in the year about you. What are your perceptions? What are some of the things that you typically hear? Whatever dependency and addiction. Me poncho, emso more chatting so far is the same names. It's a prescription drugs, loss of control, alcohol and drugs, yes. These are the things that typically comes to mind. And as you previously said, because any respect of persons and yet discriminatory, right? But the wouldn't so say, addiction, any dependency, it is not limited to drugs. It is not limited to prescription drugs. It is also not limited to alcohol, right? And as the very last comment came, we could also be addicted to so many other things. And he said, oh yeah, we say, and many more, food addiction, and it's true. Who said Dr. Friedel said, hey, in the presentation 2 days ago, she made mention to that. And also, Rebecca Marshall Kakra. MPP say addiction was a man. Maybe a binum again found. Common myth about dependency and addiction. People who are addicted lack will. Especially, and I say it's much easier for you to say, oh, that is a typical addict, always seeking for medication, right? And I say, then we have this perception about them. Oh, when you're not doing so big, anything and you know what's use, And no, maybe sometimes you're doing fast, we say no. And the perception also that prescription drugs are safe drugs. That was also mentioned. some of the things that people get addicted to. You money be one by a tie, a kind of hormone, a be a prescription drugs. It's yes, the fact is that doctor prescribe a more than just a fanasa, right? I don't mean fanasa as in fana as prescribed, but just keep taking it. So I'm a patch. And every person that uses drugs is an addict. And also one of the myths out there. That is also not true. Not everybody that uses drug is necessarily an addict. Anything a topic in this is dependency and addiction, right? And they may not even be dependent on the drug. And also another myth. And addiction is a sign of moral failure. Let me add this. Addiction is a sign of moral or spiritual failure. Ebi so adwene a omo efa hono no na che so obi ye addict wo asafo ni mu dia na che sa se ne susum ana se huhu mu no owo fem ana se so entitie no we nya ne ye na bi entisa ana only one type of addiction there's only one type of addiction treatment that works and also nya no kre Dr. Ben Emiyehu said there are different maybe one my betumi aye ebeboa yapom eden na enioma bi wonu musa na eba ne treatment a enye one size fits all enti de ebe ya ma ono ebia na anye amame right okay enti yento aso eden na tro no eka efa addiction one na so say how close can we get to addiction when it comes to the Bible enioma bi a me pese yehwe say yehwe 1 John 2:16 or say for everything in the world the last movie I do it. The lust of the flesh, the lust of the eyes, and the pride of life comes not from the Father, but from the world. Right? Enti hunam akono no. Any niwa akono. Eni oma be on ma. Yesi asemo nam eni so anekwa dai mu. Anything that we can say, entry who pi enfi computer no an answer of phone that we use, whatever device I use. Because assembly nam eni so and the year the record dai. Enti no mommy embe yehwe na intimate. In the same way no so no. There are certain things that we get dependent on or addicted to. That it's because it said yehudam no akono nti. Na amanabasa. Now, share 1 Corinthians 15:33. So I'll say, do not be misled. Bad company corrupts good character. School be Ghana, omo yusu sa montrano as omo moto. May try as a mekai, and I've asked on some of my social media handles. I'm saying a pound has something closer. So being in school corner, we participate in their two church modem. Obrabone, Yonkobone SL Brapa. Yonkobone SL Brapa. I think it's something like that. But the Bible confirms. The company that we also keep, can also affect us, right? Now, Titus 2:12 also. I say it teaches us to say no. Very important. No to ungodliness and unworldly and worldly passions.
Recording in progress.
Now, Mami White and so Eka. I say the first time the temptation comes, meet it in such a decided manner that it will never be repeated. There was spirit of prophecy. Say ebane say ensohwe na eba emra edikan a ebeba no hia no wokwa bi so say and sign emabio. Who said that is a very powerful statement, because say oma ho kwan a anaso say o defe na enye se wa hyede ma ho kwan o, but as a ade na eba no when si ano ntem na o defe no afede obehu no na ababe ye oso ase. Enti ehun hia pa se you pay attention to ourselves. And Debbie Ayameka said we should know our baseline. Okay, we should know our baseline. And they say there is any variation. As somebody says, Sakaya be a bemuna, you better know who in term na ya so ano. And you know, Obibe Busa said, and yet a dependency and or addiction, a ye den cry, and ever, a cry benso, ana a faso ever. Now, answer now, you could be dependent or addicted to Bibiano. There has to be the use. When say Bibi anko kapapa and jechende meboa. Intino I was say Bibi e shasie. I was say Bibi shasie. Intino den cry the deba obi di about or through stress, right? Say to say the Indra sister Hannah emi hu ye no. Say stress no eba also sana. Then what can happen? They say, oh, when your mama fa bibi na me fa managing me stress. What am I saying? And you know, there is always the use first. And you know, abra when you know, now after time, no, you become tolerant to it. Okay? And you know, you bought ediane din, you bought drugs din, you bought prescription medications din, you bought other things din. Okay? And you know, a bra where you know a drew baby after they become tolerant to it. Now say a case will be tolerance to something. Let's just say whatever you are using, it's gotten to a time where the frequency and the dosage now not who use and to me you. And you know, your friend say a draw or call Dr. Ben Hodom no tramadol 5 milligrams, right? What for 5 milligrams now for some time? Into after they do pempels will be 5, and to me pay you into 5 BID twice a day. After don't know ma, I always said the offer candy no. Into body no again tolerance to the medication at that frequency and dosage. Now if you want then we go into the dependency. Okay, and there may be some in between, but the person be keeping it to these 4. Then we go to the dependency, and the dependency near bra or nipediano after the edan edrono. And the edan edrono to the extent he says, Bane says, one fair drona, you could tell in Susuye and Sakaye about with you. And the Ebane Sano Suna, what you say, after the you get a withdrawal symptom. And in the Sabia say, a opioid. Who have a cramps, who have AIDS and all of that, right? Say alcohol and also say benzos, so I will not feel free. So now sometimes depending on how much you take and all of that, which may have hallucinations, delirium traumas, and all of that, right? And you know, there is always that withdrawal with dependency. Say if you hold on, and into that, will be okay. Let me move on to the next one, and I'll use that example for the addiction. Then the next one becomes addiction. Right? Now, for the that is when after the apart from say a new hormone, you have the physiological or the psychological effect, right? Which the medical boy symptoms are there. This after they all withdraw from at the corner also. But apart from that, after they say anyone no more won't be now. Say you wake up with that in mind first. Obviously, even phone, yes, and we go to and none of the debate now assembly in us. And none assembly in our Christianity 12:30. And you know, even phone, it's in the same they say, oh sorry, Anopa, that thing becomes your first go-to. And as I said, during the day, you want to keep going to it, right? Then you move from just the use of it after the any tolerance and we're building towards the subject and as I said the substance, right? And it's also not that you only dependent on it, but right now you are addicted to it. Or they not what you can't really live without it. And at that point, sometimes with all of this, especially the dependency and the addiction, na impepino you denial say you're addicted to it. Nti wo obabnu bi wo fie na tem bi ote ne phone so ana so say obi a owo eduro bi so na afi de ofa ne tem bia ofa no more than doctor prescribe say eni honoma wutimu say they are having the physical symptoms, you know, towards the withdrawal no from the medication. Any sign of money now, okay, say, hey, why are you addicted to this substance? Obakachi also there be met me here without it. But clearly, no, he or she has not been able to do without it, right? And sometimes what happens in this say a band say you recognize a crampness you did too much. Now, for us to be able to stop, no, say a big giant, a year na day. And you know what happens? Proud to being addicted to a substance, you know, and also when we are addiction now, we'll go through the phases, you know. Now, there is always a power struggle. And yeah, now I said to me, be DSC, and me pamcho we're physical, right? There could be the spiritual part, but Munim said, we mean yes, then they just say, Pastor Richard, that Pamone, Pastor Abofamo, Ebeche Sumudia. Maybe the only physical one, until I'll limit my discussions to that. And to the most, to me be a DSC, I say, oh, menye, as a man, menye, my dream one before said, you may and zoom into me, die. Oh, it is our power struggle, no course. So whenever there is that lack of self-control now, and we are not able to give up now, then we fall into it. Okay? And you know, I say, the secret to self-control is to give up control. The secret to self-control is to give up control. You know why? Say a year or so, then you cannot really control it. Because at that point, they also obey to me a year. What do to me be an a year? And you know, the secret to self-control is to give up the control that you have over the issue. Then you'll be able to self-control the situation. My confusing what I say to us. Ubet na mama hu wacha tomorrow. And you know, say, yeah, to us, na make say. Then, first thing, can I do it? Metumi aye. Sema fedro ya, metumi atena. Sema num say ya, metumi atena. Sema nya, would I be okay? And I browse why addicted is very no. So metumi ajay. If I withdraw myself from the subject now, and I say the substance now, what then happens to me? Right? And you know, you have that power struggle going on, but that is when you need to be empowered. And the will it work? So ebeyaduma. Eya yebusa ye ho sempi. Him ba ko say ye di ya opia ehia. Esa say ye fa di nyina ko rade on Bible. So we ask ourselves so many questions, and sometimes in asking ourselves those questions, you know, I say the year one am I comfortable in the position in which we are. Example, and say I mean say the every day and also say a drug doctor and the mom and my far extra me who says this the edu ne yakwachi. Ne so my first one me who no to me. Yet as it. Me who no to me. Until I was a mefa. No one for extra one. Now after the doctor no say I didn't know edu na san tem also me quote na toilet no so no na mensa na wo so na ehwiegu. If you work in that space, be sure so what is our story you be playing. The boss Anna me nana be be few honum no buy or coy and after the who the year don't need you hobby. You know, sometimes we ask ourselves all these questions so that we feel comfortable in the position in which we are. Or in who to be in the moment for come. Oh, not ya. It's a bright, yes, I know. Now for the Abusa say, now do cry, no, say, Mijaya, is it worth it? Because anytime you stop anything that you're addicted to, you go through withdrawal. Okay? Anytime I will be anything that you're addicted to, there is that withdrawal phase. And withdrawal is never fancy. Any idea will be a person will go through. And you know, say, Ubebusa say, is it worth it? Extra tablets here, you know, say, me far na yede. me jai na yede because me fa e ma me pay ne ko se me jai so a e be ma me aches, right? Me abi mu mi wo sasa brother na me saba benya ahututu aka ho double salasa. It makes us comfortable in our position, but should that be the case? Really not. Okay, you have got risk factors. Enti and na ema ebinum addicted to a substance and also say anything at all. Enti maybe edi esie ewo. Say about mental health and also say rehwemu bebre na ye wonyoma mienu, the nature versus the nurture. Unipa bain, unipa su, wawusu. Ene untiti yemu. Enti esa say, I'm say Dr. Frido said the kind 2 days ago. Say, was say, oh yeah, exam be and say, oh no, yeah, sure. Na say busa risk factors. Go with African American, and you are more likely to have it right. Okay. Esa say me yo bibini tuntum am free ebibre muntino. The risk factors on certain things endorse. In this case, me can't addiction, but me the real example, me the baby see assessment. Eti ye bosu ye nipa buying any ya wusu ntino. And you maybe we become more exposed to it. Enti genetically, no, somebody can be exposed to become an addict. It's it. Enti the car said, the Asha said, me can say, and yet say ni susumu na nyede, and also said they are not spiritually matured inti. And a man a addict. And then yes, you say, or lacking moral standing tea, and a man addict. It could be genetic. It could run in the family. A bushabu or no man. Or sure, what you say addict won't power. But Mamma Woman Castle said, bia na ne dieno, ne a yen sanom. Papa ne diene be ye massive. Ne bane dieno, ababe ye a gambling. And I'm making a point to say, it may not be the same substance of choice. It be a bit different. Now, so no, you say addiction no running in the family. Just as with hypertension, a bushebi or hypertension running. Okay, it is Anna. Anna say, who use any product, any substance there, and also say any addictive substance or thing there. Rana goes beyond substance because social media component we could be addicted to. And as I said, I'll base on that. And whenever we are addicted to anything at all, it changes our brain formation. Okay. But to begin with, the brain formation itself, as I said, genetically, can predispose us. Because I said need to be addicted. But because I'm a hope and I say a metal. I said, my quite that one. My quite that one says, why you who be there, wait my baby addict. Okay, just as once again, I am a person who use medical stuff, and the example because I am because Dr. Bemo Etaka no baby. And to the young father say, me a baby, me war a high risk is say, bet me hypertension. And just say, Bibini be having hypertension. Say at the you have to ask. Okay. And a bra me use products be, and I say drugs be, and I say substances be. A bedroom baby no, after the brain formation it changes. And towards the neurotransmitters and all of that helps us to be able to reason, differentiate between good and bad and all that, almost an assessor. Remember assignment. Maybe by the time a good student, a woman know my assignment in a way. Easy one, very easy. Look up the brain of an alcoholic. Necessary images, me patchomen could read a whole literature. Share images, ne compare, and you get what I'm talking about. Okay. Now, you have the nature. Nature no so ye bia ye tete ye. Enkrofo aye you around them. And your cophobia ye fire. And you may be a pass ye better. Last, I think said this quarter year I think lesson 1. Now your class now you discussing about Adam and Eve ne about the or any bonnet berry I say now guy back be our class on who can say. Or no, or who say anka ono na Eve na anhwa akedua no kra kobefo akwakwetena so, because as he is right now no say ye ka che say kojo enfon san kasa the way ya, now he wants to know why they are saying I shouldn't touch. Enti me de me sabe kwakoka na betutu neoma na apart na be hu de ewo mu we am asa kesi ni, right? And you know, sometimes also the choices that we make, or power be a power, and then part the was I do a muntia amount for any hosa, mammy caught trash. Okay, our baby, right? And you know, yeah, be careful. And I will tell you a story about one of my patients. But yeah, careful on your man, oh, may try. You're very careful. But back to the environment, you know. A quotation which talked about the company that we keep, right? Or say, do not be misled. Bad company corrupts good character. And you know, I also have a thing that I say, no matter who you are and how well trained you are, no, depending on where you find yourself and the circumstances around you, your position changes. Even if a penny for crop or when you really son or mobile no. Dr. Frimpong, Pastor Enchadakwa de Bioka, Quadas was him. And nay, before when you hear in our son of Mubahasi Crampono, who was on Mubano, I dream be no more for Bibi Hono, with time, no, and exposure, no, wona a pushy quacker cracker. And you know, Mumiation ye, a young Kofua Yefa, the friends that we keep, it is very important. Yes, curiosity kills the cat. Let us be very careful on the choices that we make, the friends that we keep. And if you have the genetic predisposition now, it's good to be aware, and also you know, say, Charlie, me want that risk, and you maybe one of my question. And the action you may be one man when we lose control. Say, Bane say, Yentumi and share your hustle. Yentumi and this one. And no matter being the sound that we could be dependent on or addicted to. Yedikaka ediane. Doc no a chair say portion sizes. The ending sizes if we share them share. Cratchy via minimum was central zone hono man and share na. This is dog with the waka dear. You be fall, but a betcha. Because the other side is when dear. Oh, but food is something that we could be addicted to. If you all know ma, you're for comfort measure. Oh, when you have depression, after they attend to this food, and after they have become a hormone. So now you become dependent on it or addicted to it. A bit here is sweet. Oh, doko nyomano. Hey, no, we typically get addicted to it. To go on mass when the chocolate beer won't mean that. So when the beer that was won't mean that we will let you poor mastery. Then no me there on to be Gary Sokins, the condensed milk and qua the begumuno. At the forefront. Now sugar woman that down. A cat you answer not the condensed milk, a whole tin of a goo. No cow say, I did there's so new beware, also a name. Those are some of the things that we could be addicted to. Food. Now, sex is so yeah, be addicted. Until you have people that are sex traders. It is not just because of the financial gains, right? If you all know, it is because they are addicted to it, and that is why they are into it. If you all know, some other things that we could be addicted to, gaming. Gaming, they brought it home. What's the first part? They just also read Wako Casino. Now, Casino, na say be other committee be unrelated to the casino part. No say no war conferences or no. Now after the other vehicle no be who down or game here into no see there. Or would their brain will fear. Corona no so crap making it easy. So right now you have all the gaming stuff on your phone, especially for those of us who are into sports. To say there, Omayama, some sports are associated with alcohol use. You know. Since gaming is becoming associated with sports, right? And that is how people are paid millions of dollars to study and bring these things out. And you know, that is how they are making it glamorous. Omo mana ayefe, amana ye anyone efe, na aye nije. And you know, so team will buy yes betting on it. And you see, there are so many betting companies, and I know people are listening to us from Ghana and all over the world. Ghana, what you see, right? And you know, they are making it so convenient for you. One video on social media where somebody was sitting in the church and a bra or te asori honum no na or bet it on the phone, so right? And you know, they are really bringing it to our doorsteps. Now, the other one is social media. And with the social media and this addiction, I don't know DSM-5 not yet, but I foresee very soon it will be a part of it. But either way, no, I'll use that to really explain dependency and addiction. Then we'll open it up for questions. But the other thing that we already mentioned, drugs. Okay, so drugs, you know, we have the prescription drugs. The doctor hold our prescribing mao. We have the illicit drugs, the Wall Street, the okay. Now, Hassan, I say, Mama may share this experience, and as I said, experience that a patient shared with me. This patient was a repeat patient or Thai ever. Now, I said earlier, and sometimes when you see them so often, it makes you think you say, now they only want to be. And to that point, they say, why do you keep doing it? Though you know it's not right. And this is a patient we use IV drugs, or shooting like through the veins, you know. We're shooting up on the veins, you know, the left arms need to blow up, right, blow up, and I would do left leg, right? And left leg, you know, around 2-3 years ago, there was a drug now with heroin to shoot. And so laziness shoot now for the potency. Now, so shooting now, it blows the veins and it turns blue. Now, and light skin for no who says the veins are turning blue. No, I said shooting us are turning blue. And then I was asking him, Master, right now you're down with your left arm, you're down with your right. You're blowing the left leg also. So you only be left with your right leg. So why do you keep doing this? And he told me this: you won't understand. You only get high once, and after that, you chase after the first high. The best thing is not to start. So I cannot forget, and I remember the words verbatim. You will not understand. You only get high once. After that, all that you do is to chase after the first high. The best thing is not to start. Ejidifo, Mesra was said, as we earlier on said, curiosity kills the cat. Mesra, and you may be a hodoma, and shasie, may pemehu, and a year day. Unima, ignorance sometimes is bliss. Peube bitina. And he explained it this way: when you shoot the first one now, so high now, unyano, opesa use chasing. So you keep doing it. But Esa said, body was never exposed to it, and you had that shoot, you will keep doing it and you will never have it. But that is the feeling, that euphoric moment, and now opesa unye biu, until you don't have the ugusu now yet. What is it? After the ugusu now oh yeah. Until now, and more so addicted, and apart from the deformation to the brain, after the ugusu, the physiological part, ugusu chesi sahaido, ube chesi awunya. And no, Anna Mekai said, Solomon said, it's all vanity. Yebeye, yensanka. Enti mumi anshe so na yenhwe niye. Na nyasa nyo mebi on ma odo hu bekwa kogim. Ebeye den se obeti hu afi. Okay. So now let's look at internet addiction. Internet addiction is one of the biggest things. Meaning say drugs, alcohol, substance, and all of that, it is prevalent among our community. But I think it said the rate may be relatively lower This is not based on studies. I'm just assuming, okay? But when it comes to the internet, we are all in it. We are all in it. And let me explain, say, any addiction affects us, our psychoactive part of us, right? What it means is that the way the brain functions and the way it works. So now let's use this. When you're addicted to something, it alters your mood. Makane dada. Esesa unipesuno. And as I said, usuban mood yede. Esesa watenka. And I say the way I will feel it. I'm keeping it simple. The way I will feel it, esesa, right? And it's mood altering. So now let me use this example. My time no yaso. Into no run faster from here. Because I am percent of full booster questions. I know it's a Saturday or maybe on a Saturday. Let me use this example. Yeko youth camp. I think that was the Marietta one. So that was year zone Indian. You started for zona 1. Now there was this young guy. Na nebra amba Tuesday na yeko no but Thursday. Na guy no ebeba youth camp no order them pabo bia a matching entire. But you won't follow me. Oh, Lucy, me, I want to see the mechanism. While order them pub be a matching entirely. And pub one number Tuesday and Sunday no back camp. And or track here and they say a bit deliver Wednesday. So this none the brand also paper Thursday. So it worked out for him. And so no become by Tuesday. He had planned to wear that combination of Atarian and Pabuano on Thursday number. No brand also delay or a month. This guy had to perform because as a pabwane back, no match atariano, and son away to be the stage. So now I ask a question and I want a response. Say, Obi say, with this conscious effort, and we also trap it at the two Instagram after where you still filter in now. Let's say Dr. Opoku, one call like here. What do you think will happen to the self-esteem of that individual? Let's say Sister Lydia, so I'm commenting. Let Dr. Hannah, so I'm clapping emojis. Let's say Obifu for also the point I'm making is you post on social media and you don't get the response that you want or desire. What will be the effect on such a person? Yet, Mazie, we're talking about social media or internet addiction. Okay? And these things will alter our mood at any time because we become so addicted to it and it's affected our thinking, our thought process. So we always want to go and then post, check, and read. Okay? Okay. Abra you use social media and also no. We lose track of time and space. So one share as well. Me prepare for this presentation. I was like, okay, let me practicing your maybe. Of course, I always use my phone. I'm no exception. But then I wanted to pay attention to certain things. When him says, oh, share WhatsApp status, or clock, now I know what top right. And I don't know about Samsung, and I say Android for. But iPhone, and I think it's the same with Android. But I can say for sure, iPhone, or share WhatsApp status, or clock now or top one of no, it disappears. Or status no cavaso. So when you try a cavaso, I don't know the thinking behind it, but this is what I know. It keeps you out of touch with time. Yes, yes, yes. And you can stay and watch status. I'll skip you or shedding in 30 seconds. So be answer my 2 minutes. Cramponess and nipa 20. Yes, it will be transfer to shower. We are waiting for hey, instead of me. Okay, we're talking about dependency and addiction. I said the devil is a liar. When in the house of war, oh, so we lose track of time and space. This is another example. When you say social YouTuber, right? Then you say, oh, it's in the minimized form. Let's say, oh, share like a whole YouTube video. It also takes away the time, right? So you could stay on YouTube, and what it does, you also say video now we are another suggested one, Beba. And you realize you said the suggested one that follows, and it's something similar to the one that you were watching. So it sustains your interest. Internet addiction. So we talked about staying on it, right? And then also gaining the tolerance and then the dependency. And wedding in our apostle, yes, African movies are very, very true. Oh, and I same on Netflix. All of these. And a similar one to sustain your attention. After they know it, by the time I home, not a miracle. We lose track of time and space. Okay. It also gives us an illusion of efficiency. Oh, I say me ye be but ube edano ubisa won say ede pa na maya. Eya na wo answer you say. Apart from so share a jakwa na was which is therapeutic. I have nothing against that. But bibia wonimre. What am I saying? Enti no ube hwa after the eba no ube hu no, then you've lost track of time. Now, this is the other thing too. It's very, very distracting. Eyi yadri efi enyomaso. See, I know you would want my meeting crown kwasia. We're still on our phone. We can't live without it. Ye bubu ono ma say ye nam crampuna na ye text. Ebu on my ye driving crampuna na ye share YouTube video. Na ye text. Na ye other activities on our phones. So it's distracting us all the time. And you know very well, so when we talk about dependency and addiction, as I mentioned earlier, there's always withdrawal when the thing is removed from us. Until now, what J with teenager phone pen? My pause for a reason. I want you to think deeply about this. The tantrum that they throw when you've taken their devices, okay? And it's not just more. So one kasano crampon, so what training be? Next year, catch up and say, when you now from a phone, and who has say, how do you feel? Because Tawada me do and your committee or national, my boss back home. You draw the man of the basket, but we are for the food. Then they were a Libya about for the share if a Nikuma and Kobuku lady knew yes in that day. We'll do anything to go back for it. It is very, very painful. And whatever they say, nature puts us to sleep. You cry for now, nature, I'm a yada. And what do we do first? Okay? So anytime it's taken away from us, there is that discomfort. So as soon as you wake up, the first thing is to go for it. And to say the current, a call, a blue kiosk on 4 o'clock. It is the same thing. And as I said, you wake up and you feel like you got to pop another pill. It is the same thing. Okay, so let us be very, very mindful. And that affects you also on our performances, whether job, school, and as all of that. And also, it leads us to sedentary lifestyle. And we have to exercise. But we are staying on that phone. Okay. Let me give you these two other examples on internet and as a social media addiction. So one, ASA, say your phone vibrator. What happens to they say, oh, hold on, ma, and I also phone vibrating, true or false? Oh, hold on, ma. Now you say oh phone vibrating, do and also because you have that sensation. If one ma oh ma, you say oh phone ringing, and so phone ringing because it's a word in the air say you always like the mind is not connected to the phone, right? And now if you are also now, my phone a stroke. Sometimes maybe also now my phone was here. My phone so entire that ring because they are not ringing. Until we started to vibrate only. right? But friend so dia mefa. Me was roll phone be vibrate. Ma e wo phone ho wase. Ma ante say phone ring. Me be fi sure be answer me for. I say now you dey who say phone ring. It is because he said the mind is connected. It is vibrating, yet I could still feel and hear it. And I'll come and answer my phone call. And you know, those are some of the things. One really here, you don't pay particular attention to it, and it eats you up. Make I say me use social media, but the point I'm making is let us be very mindful and very, very careful. Okay, now you find say any addictions or any dependencies. What do I do? And then SME. Me run it quickly. Now after it's me a busan sem kakra. The aka in First of all, Evangelism said your problem. That is the first thing. We have to accept to say we have a problem. Say yes, adia. Obia waira onukwa do ni baby o. And you know say if you have a problem and you're not admitting that, it will be very difficult for anybody to help you. Okay? And you know one, Evangelism say your problem. Two, now we should have the willpower. And having the willpower alone, let me explain it right here before I confuse anyone. Having the willpower alone will not take away the addiction. But I don't know here, Emma, after they receive help. Or person ye better, I know here. Meshabo, and you switch and so what and then the off keke. It is a people, but I didn't know to be in China, Yamasa proper year, and you know, Johnny did. There be Yamasa risk level, different. The environment, different. The support, different. And to the Opia, a dance. Messabo, and yes, switch, and you do know. Yantia says, Adia, Medi in fear bebre, and not bebre, Busumi bebre, Esiana Mayano, and then say Bejana. Yantia says. And to know any BBA, oh, Majai, oh, Charlie, this our feast of, oh, our feast of, when I love Manyamaka, oh, boy, won't mean Jaisa. I was said, will make it a conscious effort. Now, put me a follow through. Say, Hono Samantia, make a pigeon, and I make a cry. But the same thing I make. And you know, Mumme and Shannon Sosa, and I don't ignore your cravings. And to say, oh, dear, any candies, oh dear, any drugs, no, oh dear, any internet, no, whatever yours is, don't just ignore because about the we ignore all kind of power struggle. Now I say after the ordinate in time, but accept it said there be I do with the weakness. Me now about the say bar so you acknowledge it and then you find a plan. So, oh, yes, oh, there be a new one of then you go back to the denial. Also, there has to be the willingness. Oh, into the Abra, what you have to know of Pepano. Now, who said the cravings, now for the when you or penny said, what do they now find something distracting? It's not become distractive now. What I mean is, say, a banner said, Bibipa Uchimu say, oh, menkoye this whatever I'm craving now, and also whatever I'm addicted to now. Process it first. What that does is it separates you from the item or the subject matter. What you say? And to say, be out there and son, and also say, oh, there a pills out now, pop here. So, part they say that cravings comes up now, then you start to process it. You find something else to do. You distract yourself from it. Then it separates you from it. Okay. Now the next thing also say, therapy and medication are forms of a treatment. And as I said earlier, treatment is not one size fits all. Obi on my therapy man, obi on medication man, obi also I just on the cabo. But as Christians, sometimes, you put one man, pay you or hold man. Say Christo for dear, and you maybe one man is here. And once a mental health issue, or who therapist or a psychiatrist, or there be Ujidi Anu Adu. Yanko Paibu, Michelle Empire, dear, and so Jacopo now soon the mind, dear, and so I desire. And to be punctual, Yanjay is also any. And it is okay to have Christ and to have therapists. Did that sink in? And I mean, give you, it is okay to have Christ and to have a therapist or a psychiatrist. And to be someone, there is nothing wrong with it where we have to seek treatment. Let's do, because there are some addictions that we cannot overcome it at home. Now, finally, now for the Musa questions. Build your confidence with these forces. Build your confidence with these forces. Be competent at what you are doing. So learn, train, and practice. Okay? So if I'm addicted to the internet and I want to get over it, I have to learn how to get over it. I have to train myself and practice it. And to say, may share status. I know, say, I'm watching it for 2 minutes. Say, periodically, no, may feel status or no, no, 2 minutes as one. Say, I saw a major. So you have to learn, you train yourself, and then you practice it to become competent. You also have to be responsible for your actions, consequences. Oh, and your madam for when the mammy are coming, I do wake up, coming here, be that. A drone, my yes, and then find the extra one. Right? So we always apportion blame. The kid, only anyway. I'm my brother's keeper. And I use Adam here. Adam way. Or say, me kote. Now, the because I didn't know and your man or did mammy. Oh, can you order? Yes, yes. But we have to be responsible for our actions and accept the consequences. And then accountability is also key. As part of consequences, you know, we have to be responsible and also be accountable for our own aid. Then also community. Endra, Auntie Hannah, Eka about support system and have this big thing about people that say, oh, Ghana focus, I don't know, they've been paying Ghana for and all of that. It is your choice. But let me tell you, say, this psychosocial support system that we have, a very strong and very good. Me patcho me miembu ne limtia. Ada asembetono and obeti de make yas. And when we say psychosocial, it is the psychological and social support. And to know this social system that we have supports us psychologically. We can't backwards. Yet as it. And to the patcho me yem to tunase. As a fune da wasa no me patcho. In fact, so be brave. Ewo, ane ye nipa obi beka me ho asem ebe ha me. Eno no wo hono. But enye nunti na emwa hodo a efimu ba. Ebe fi hono. Eno so Auntie Hannah can be, which is very important. Talk to someone you trust. People just say, "Oh, ye penimu, we ye kendini, we ye obi ewo asafunim." Anase se wadamfu bi oni asafunim po. O kan na sem chewa e san se oji udinti. So person could be called the call era 1 radio. And also they call Yonkudo radio. And also they call CB radio. Or person will be a betting. I don't catch a waso. One can't share one no. But we would have. So be a boom free. Last one, the choices that we make. Mumaye making right choices. Because the choices that we make today will affect us tomorrow. Minimesi has said, so we ewo asembia me pamocho obetimi ebusa na afide ye yi ano na etimi aboa yedishi. Madam Asepe.
Dog, thank you so much. I think say wa baba and same mo ye pan. I think say most of us ya have been them say o trail line bi na me say wa more so but na we slide. And I mean I decided to write it down. Or see, legal does not mean safe.
Oh yes. Yes.
Legal does not mean safe. I love that line because yeah, or my mom says, yeah, in the Bible, no, it has been legalized. So the question is that the fact that they said it has been legalized, and that does not mean that it is safe for a Christian to use. And I wrote that line of
very good. My shadow, but it showed me so don't pay attention.
Yeah. All right. I think that the questions, and I shall say, maybe can't for the first one, at least you were following the chat line. Will be the kind of question back where the camp already and sana ya or more so normal day questions about. The first one is if someone smoke weed and he decides to stop, does the person have to detox, or what are the processes involved? That is the first question.
So the answer will be generic because, as I said, there's no one size fits all. Right?
Okay.
Anytime there is any form of dependency or addiction, in this case, also marijuana and as a weed, say every open so jaya, ubu on ma or no abeti mejai, and your problem man, or no abeti mejai, obesia how to go through the processes, not wejai, and no honor. Ebu horrible so that it was said or get substance abuse treatment involved. Okay. Now with me, a detoxing of it. In most cases, say marijuana and I say weed in India. In most cases, or one night and I say with the help of a friend or something like that. But say compared to some other substances, I want advice is over try with you. She said if you movie or say do not try this at home.
Okay. That's it. I think that there's another question I'll say, is there a good or beneficial addiction?
Too much of everything is bad.
Okay.
I can say, oh, Christos, but even the Rockapon, but they do pepper, so be a see or more a Jumaya crime. Yet be a quack share, Yame. Yanko Ponso, my Indian Quancha, I say, editing assassin. Okay. When we even use that to the point where it is clouding our judgment, then I think it's problematic.
Okay. Thank you. I think for many, if there are any questions, I don't actually see any hand up until I don't know if there are any questions. I think our technical people are helping us. You can also put your question in the chat section if you have any questions.
Doc,
there's one.
Oh, sorry.
There's one from Leo and Maggie.
Right.
Okay.
I don't know if that's mentioned already. Are there any beneficial side of addiction?
Yes, and I'm side.
What's it?
Oh,
and I'm say, are there any good or beneficial part of addictions? And yes. Okay. May both are raising and some. Yes, may both. And our technical people wait my boy and next maybe send a question.
Yo, Bacho Madam Wasi, Doctor Bacho, send your call, yeah, annual checkups, no.
Checkups, okay.
Mental checkup, so the yafa me who here say, Abia, Afibia, so young Konya share Binumana.
Mr. Because of course the almost every time I'm representation will be busa. Idea who here, but I say preventative medicine and I said you check up near the corner. So call PCP Hodoma as part of checkup no more there are certain questions maybe do you feel safe at home near your man? But unfortunately, no, they don't go much in depth. Emma say bibu Hodoma and as I say, apart from say you don't feel safe at home and now they don't pick on it and then be able to follow up with it. For now, they as part of maintenance medicine, no, and yeah, dear, a mudopi, can't your treatment modalities. And it's usually I had a secondary. Oh, I say you and it's not at the chair say no. And to answer your question directly, no. Oko PCP Hodoma, me patchobet my stress on the fact is that we're looking more into such a thing and obey my boy.
All right, thank you so much, Doc. There's another question. I'll say, how can parents help their upcoming children not to start any acts that may lead them to addictions? Quite ben so na you know say our phobia platform say be so here from Ghana. Which we are very grateful. So be a honor parent to be a quite ben so abo ne ma ehon ban a omuntimi start be a believe you omuntu nioma ye keka ho asem.
Okay. The kind your cobon is brapa. And be careful and pay attention to the friends that your kids make.
Okay.
Uncle for money now no make I see so Papa because say a branch will be person we could few you. Now you after the Matias.
Yeah.
Into no ye the dikai, right?
Yeah.
They toss me no more and no money more and fat and no ma air cost. Yeah, you bet you to say your more frano and nim the cost and they essing ye no. What do I say?
Yeah.
But there are sometimes me who say, especially in our Ghanaian community, no. So Obu say a question be a comfortable with her. Now I say you per se a tram so. Na ye jahoko. But all they say near dinner, yes, all the tram so now. Obeko pe or baby fufro. And to let us be frank with them. See any mamma patcho manu so unim, ne kwashishe. And I pour beer on him a man, no intimi no man. Right? And as they toss be on so no say more friendly co school, and as I say almost share to baby as yen take your time, yen no moncasa. Near who say be a bibi cheer. There could be a peer pressure from somewhere which is leading them to certain behaviors. And you know who a tech chair, and Obo say, okay, start casa back, and yakwa, if you baby neighbor. Oh, Obo say, bedroom baby, no, not oh, Phyllis say, well, who more than what the parents? I offer what has in part of Mood doesn't weeping. But since you know, a kid in high school typically will who be paid. What is it? It's and secondly, no, so they pay attention to them. Say, whenever there's a variation, we'll be able to tell.
Okay. Dr. Freda to also like bullying, any of those things, and
exactly.
Who we're seeing. And now, my Felicia Bokote editor said children and youth are screened during annual physicals. In TCC, they started screening the children and the youth during the annual physicals. Okay. There's another question. Or say, is it good to make them aware about alcohol and drugs at an early age? I feel like creating the awareness rather than curious, like making them curious to want to, like, to make them want to try.
What do you say? I agree, no. And so the crow woman say, so one chair now, obeku ati, esio baby fufu.
Okay.
Yeah, you might music videos, yeah. That is how they saw these things to us to begin with.
Yeah.
And to all parents in the crowd, no, dear mammy was said, so what ye Ghana for your man, a womb. What ye abrofu dear, a womb.
Yeah.
It's now it is being introduced to us subconsciously.
Yeah.
And it is better say, Obabada who say, idea omo chair or music video, and I say, idea almost show a TV suite. Ebia enya depa. Ono ma say na de bro. Ane ebinum nom de. Me pamcho sa na metie bi o say da bi enya sa. Na me baba ko ebusa. She's only 4 years old. Ono busa ne na say no ne kaze ba ko no so 4 years. E di nkobo. Ana boy ni busa girl ne say oh ye enshasma de me man enshasma de. Ana girl no ka say oh no, they do. Ana ne na fish robe and okay say no we don't. And I said, but I've seen people wear it. One boy now with 7 nearby said, in my class, there is a boy who wears earring. Yeah, there be a binumo ye. I didn't see the binum ye. Nay, ye, no, they are chill. See, you must have blanket straightforward answers now. They know more than what we know. And usually, we say ourselves, no, just say, or my two baby dada.
Thank you so much. So be another question. I think there's another hand. Lydia Odum. Now, whilst you're on mute, Lydia, we say, what are some of the signs if a child starts to use drugs?
So it will vary.
Okay.
We say drugs in your muahodo, your downers, your uppers, right? Until you go all the ma or far about ye slow and more ye say. It will also our far a bit more until whether the person is using a downer or an upper. sometimes also some behaviors are being they say after the true ones about more life. Anna or 30.
Okay.
It is a critical school that says oh by 4 o'clock. Now if you over here not by 7, 8, then you know so there's a problem somewhere. You want to investigate. Make caso you should that, but you want to investigate. Okay. If you want also now, Ubo say after the oba no sneaking up a basement or no. Because on person one leader so be piano and as so be say the near is saying and as a visa. Oh, and you know, as you pay attention. Also, you check your mobile backpack.
Okay.
Any memo, they may not expect you to search, but or your back what you fear, search it.
I think that I'm so happy with some of the questions now about now. It just brings to mind, like we are focusing on drugs and we're saying now one of them that comes readily to mind is about the food addiction. I was reading one of these research articles now. I said some of these food companies, it's not even the pharmaceuticals, because most time some of the food companies didn't even target pregnant women. And the kind of food they eat, like the sugars in any way, saying your mom a crave and almost I say, and by the time I cry already you talked about the genetic components, or mono, they are not even looking at the environment. Maybe I want to easier so if you environmental no probably will be controlled. They are modifying the genetic parts and the nip those kind of food, into no manner the normal ones that they say near Dr. Freda Motre, and they are not willing to do that. They're open them. The dead the man. So I think that those are some of the things that we also need to look at. Said even for pregnant women, we also need to be very careful on our food selection, because it also goes to affect the formative years now of the unborn child. And by the time I run some of these addictive predispositions will already be there. Mrs. Lady Odom still and Sana happened to if there are technical people with me, I'm in and Sana hand it over to our coordinator. And obviously, do we search their backpack secretly or openly? How will they feel if they realize that?
So what's that? You have to always have a relationship. Yeah. So if it's an open book, it's an open relationship where they know, so my mom, and also my parents always have that relationship with me. They come to my room, they help me clean the room and stuff like that. Now, opening the backpack becomes routine.
Okay.
But then there's that distance. Now, the woman,
okay. Mrs. Odum, I think that we take the last one from you and then.
Doctor, Madam Wasipa, Doctor Yentumi, so Yami Shaw, and sister Anna, or my Dianipa, now what they dessert, another couple. Any previous ones, me now. At some saying, me vampire say you be fun very, very serious, because if we know a platform, yeah, so say a 4 platforms. So to my young fan, very, very serious. Now, me, my back one person me to addiction, as some young will say. In fact, you don't know until you know. And now you never know what you have until you lose it or whatever. What I have experienced about addiction, common popcorn, me wa Ghana. All of a sudden, I became addicted to popcorn for continuously about 5 years. And I say, me popcorn now, me handbag, be blow back with them. Me to me fa car, me fa dropping on my top a bro yachi. Me fa dropping with a bro. Tell me, I want to chew a bro, and I say popcorn. And me da cry and I do me never cry me to me fa macaroni and me boom me de book prime na machi na my just I want to chew on something crispy or something, but I never said chips and it was popcorn or a bro. And then I have me could be some doctor or see on your But me a hono a hami pa na ade no me pe, but me who all of a sudden na me adapted sa suban. Enti no me who say me pe because it's too much for me. And I mean to mean jai. Enti no me baba brochi na de na me bi sa me ku say e ho popcorn wo kwa onje me bi wo ho pa on to be so. I say e no na me de beba. Me to me crave for me Gary Gary fresh pa na me something crispy but any minan e bro. And you me bedu hanu nature no na me be yare pa. I think to say me ya ni minan na accumulate bibi e koso me when am gino. So enti no me sre when wo say you can addiction na so many angles but me be say e bia to me na make us no me no man say na say cigarette and I say even coke I'm not addicted to, even drinks minerals I'm not addicted to, but when it's way me this year dear and my me who say addiction ba wa bra boma so once see 9 year pa obi aka bibia chewa wonte enti mama yen hu san kofo ni mobo. These people need they need us, they need people to get closer to them but not to just push them away or condemn them or enti nya wo kan pa na eboa me ade ba ko eboa me ni Galatians 5:22 say Yesu obema in self-control. Self-control no was so papa na sa Bible akatem to woman self-control and they only say me pa but because nyame na ma me ahoden a metumi dia control me them adena crave me no because even people crave for anything some na yes and my mom pa ma sa de ni fi ho because before you realize na asel wo time be sell wo be wie no we are who say ye na we wan na de ba your bonsam timisra a holiday nyame kwa na wo mo are addicted to anything at all. First me pay pieces direct and son they be anything kwakwa so kwakwa your addiction because they pay what it when you be want some can what it and you na kan sa supan kitin na no nyame why na yenjai.
Amen. And that's it and that's it.
Mrs. Boachi, I think that we'll leave the rest for you. I think that a time and a call. Into other questions, we'll leave it for Sabbath afternoon.
Yes, everyone who has questions, let's hold it for Sabbath afternoon. Thank you, Dr. Philip. Thank you for what a wonderful presentation you gave to us tonight. We thank all the speakers this week. God willing, tomorrow at this time on this station, we will meet again for another wonderful service. Please, we encourage you to invite friends, family, your neighbors, extend the invitation, and we will meet you here tomorrow. Shall we pray? Our Father and our God, we thank you for what a wonderful presentation that we received today. Lord, you will give us a victory over all these addictions that we may encounter or be exposed to. Please be with us as we continue to learn more about your will in our lives. Be with each person on this platform, each family represented. May your grace and peace be among us all. Bless us as we depart from this place and wherever we may go. In your name we pray. Amen. Good night.
Good night.